Hello, everyone. Today I'll be sharing with you findings regarding work-related stress among law enforcement here in Minnesota with an emphasis on the effects of COVID-19. Over 1,500 full-time employees have been allocated by the state of Minnesota to serve its 1.8 million residents. Serving the metro area with such limited personnel has amplified the existing levels of stress and thus has become a high priority issue for both Hennepin County Sheriff Office and the St. Paul Police Department. With the sudden disruption of COVID-19, new sources of stress have arisen, impacting law enforcement in unknown ways. COVID-19 has resulted in over half of all of line of duty deaths in the US alone in 2021. Out of our study population of 417 participants, a total of 17% tested positive for COVID-19 and 19% were vaccinated. Furthermore, following the murder of George Floyd, over 200 Minneapolis-based officers have filed for PTSD claims, highlighting the effects of traumatic stress responding to the civil unrest here in the Twin Cities. Because this study took place during a global pandemic, we were able to address the following knowledge gaps. First, identifying the novel stressors introduced by COVID-19, and also answering the question if stress levels due to COVID-19 vary by position within law enforcement. To identify novel stressors, a qualitative approach was used. All interviews were conducted on campus, over Zoom, were audio recorded, and followed a semi-structured interview guide for a standardized process across all participants. All 37 respondents whom we interviewed discussed in depth why COVID-19 was particularly challenging, and we've identified three major themes. Respondents discussed the potential affecting loved ones at home, the desire to be vaccinated before being sent out to the field. Overall, a majority of respondents discussed the anxiety of being an essential worker, not knowing if the person they're interacting with is actually positive for COVID-19, as shown in the example below. We respond to medical emergencies, so we're kind of going into the unknown. Sometimes you ask ahead of time if they have COVID or not, but sometimes you don't find out until you're there. A web-based survey was also distributed to all 417 participants. To investigate the relationship between stress and exposure to COVID-19, the questionnaire had around 129 items and took on average 10 to 15 minutes to complete. This particular survey measured two sources of stress in policing: operational and organizational stress. Operational stressors are duty-related and include responding to scenes of violent crimes and witnessing scenes of death. Organizational stressors are stressors more associated with the agency, for example, including administrative responsibilities, lack of training, and staff shortages. Now, the reason why we compare job classification is because over 300,000 civilians are employed in non-sworn positions, and they also operate within the high-stress environment of law enforcement. Yet very little is known about the levels of stress within non-sworn workforce and how they actually differ from their sworn counterparts. So, in regards to mental health, we found that the proportion of those who screened positive for PTSD symptomology did not actually differ by exposure status to COVID-19, regardless of job classification. Operational and organizational stress were not driven by COVID-19 exposure for both sworn and non-sworn personnel. Now, we anticipated that COVID-19 would be a significant mechanism for stress as law enforcement operated as essential workers throughout the citywide lockdown. However, we believe that maybe one potential reason for this unexpected finding is that the study was conducted between May of 2021 and October 21. This is when Minnesota was actually experienced a steady decline in COVID-19 cases. Overall, this study found that sworn and non-sworn personnel had comparable stress levels and mental health outcomes during the global pandemic. I want to quickly acknowledge my collaborators who supported this study and also the Midwest Center of Occupational Health and Safety for funding this pilot project. Thank you all for listening. Very much appreciated.